How often should I receive neuromuscular massage, the revolutionary method? We get that question a lot, and here's the best response. There's 168 hours in the week, right? So if you can touch base with your therapist a couple hours a week, 2 treatments a week for just a couple weeks, maybe 2 or 3 weeks, maybe 3 weeks, where they're bringing your pain from a 6 or a 7 down to a 1. Maybe you came in with an 8 or 9, like extreme pain, and they're bringing your pain down to like a 2 or 3. They can do that in a few weeks, given the opportunity twice a week for a few weeks. Now, twice a week for a few weeks, it might be 3 weeks. It could be 2 weeks, 4 treatments. It could be 6 treatments, 3 weeks. It might take a few more weeks than that. Who knows? But I would definitely start with a minimum of a couple weeks and see where it goes from there. Treatments build on each other, right? So if you're only going like once a week, that's really a maintenance plan to get out of pain, right? Because like once a week, that's 1 hour out of 168 hours in the week, right? So they need to touch base with you to treat your muscles very specific, to give you a lot more relief out of your specific muscles at the root cause of your pain, make recommendations, a recommended plan for you, teach you how to maybe sit better, walk better, sit better at your computer, maybe stand better. There's a lot of things that a revolutionary method, neuromuscular therapy method can help guide you on. But as far as the treatment, I would say at a minimum, a few weeks, twice a week, and then the goal is that you scale back to then once a week, and then the goal is twice every 2 weeks, and then the goal is maybe once a month maintenance, where you can maintain that 0 out of 10 pain level, or maybe a 0 to 1 pain level. They're just maintaining it, and that you can still come in whenever you want. A lot of clients still come in because they just want the extra relief every week, but they don't need it, right? They don't need it. But coming in twice a week for a few weeks initially is because it's needed. It's what the therapist needs to help get you down, get the pain levels down. After that, you can scale it back because you just want to. It's a big difference between, as you know, needs and wants. Okay, our goal is to get you actually you can come in because you want to come in. And our goal is actually to completely release you. That is the best mentality and the best way, the best mindset of our revolutionary neuromuscular therapists, is that they learn that the ultimate goal is to release you and get rid of all your pain. 100%. Because not only is that good karma, so to speak, but it's really the ultimate way to have the best interest of the client. And we know that if a revolutionary therapist understands and knows that with the end goal of releasing you where you don't need us at all, that you're always going to trust us and you're always going to come to see us if you ever have any aches and pains, and you're going to send all your friends and family to us as a solution to their aches and pains, because you know that our end goal is to release you as quickly as possible so that you don't need us. You can only come in when you want us.